Hi, welcome back to my channel. Today we're going to be discussing CPR with babies along with cuts, scrapes, and splinters. Stay tuned. Okay, let's start off with CPR for a baby. First of all, what you need to do is you get the baby to the floor if you think there's something a problem. You want to make sure there's no dangers around you. Have someone else call for help if possible, or yourself if you're the only one there. You want to gently put the baby's head back just a little bit, and you want to listen for breathing. And you also want to watch their stomach for breathing also. You can tell if they're breathing that way as well. If they're non-responsive and you hear little to no breathing at all, you need to start CPR immediately. Where do you put your fingers? On the chest. Find the nipple line, the line between the two nipples. Take two width fingers, down from the nipple line and start compressing there with two fingers. You want to compress 30 times. Your rate's going to be 1, 2, 3, 4, 5. Baby's heart beats way faster than an adult's. You want to do 30 compressions, and then you want to breathe into the baby's mouth for air. You want to put your mouth over the baby's nose and mouth in order to get the breath into them. They're small lungs. You don't have to go and then put the air into there. Just what you have in your mouth is absolutely fine. So that's all you need to do into the baby's mouth 2 times. And then you go back to your 30 compressions. You continue to do this until the baby is responsive or help arrives. And then at that point, the paramedics will take over. But you need to continue to do this as long as you just can't stop. You have to continue to do this. There's no shortcuts around that. You want your baby to be good, and you're probably using that technique. You could save your baby's life instead of trying to wait for someone to get there. There's not enough time for that. You need to be proactive and do something with that. Again, the Red Cross courses really go into more detail than what I just did here. So I would really highly recommend that you call them and get in there and take that class. It's just so important. Okay, we're going to skip on to cuts, scrapes, bruises, splinters, that kind of thing right now. Simple little cuts around the house or whatever, that's no big deal. Make sure you have some antibacterial gel around that you can put on the cuts. Clean it first, put the gel on, and put a Band-Aid on it. Hopefully your child will leave it there, but more often than not, they end up trying to pull them off. I used to hide my Band-Aids in the house because my kids would use them as stickers and take them and just, they would use a whole box of Band-Aids in a day. So I had to start hiding my Band-Aids in my house. As far as deeper cuts, it's up to you. I'd say I have a mother's eye for this, and I could tell whether it needs stitches or not just by looking at it. If you don't know if it needs stitches, go to the emergency room. Just have them check it out. It's better safe than sorry. If there's any gushing blood, obviously you want to apply pressure to the wound while you're going to the emergency room. Have someone go in the car with you so they can apply the pressure to the wound until you get to the emergency room. As far as splinters are not my area of expertise, but I've had a response saying we need to talk about splinters. What you need to do first, I think, is use ice to numb the area. And have a second person around to hold the child if you can. Once it's numbed, if the splinter's under the skin and you can't get it out with tweezers, right away take a sewing needle, sterilize it by putting in rubbing alcohol or fire to make sure it's sterilized first. Cut a little bit above the splinter so you can get at it and then pull it out with a tweezer. And in some case, if you can't get it out and you're just stuck, again, go back to the emergency room. If you have enough children, you're going to spend a lot of time in the emergency room. I know I've spent a lot of time in the emergency room, from cuts, bruises, asthma attacks, oh goodness, just all sorts of things that I spend a lot of time in the emergency room with. So that's basically it for today. It's kind of a shortcut to things that you need to do. So this video is quick, it's fast, but I don't want to bore you with too much detail. If you have questions or anything else, you want to see a future video, that's fine. Put it down in the comments section. I want to shout out to Samurai3071 who left comments for me to do this video, plus a homeschooling video, which will be uploaded on Friday. This one will be uploaded on Monday. So I hope this was informative for you, and I should see you on Friday.